Hi, my name is Hunter, and today I will be performing the skill of inserting and discontinuing an IV. I have school appropriate scrubs, I have my badge on, I do not have any polish on, and I am not wearing any jewelry. So for this skill, we have our forearm here, and then we have our supplies. And my supplies have obviously been tampered with, given practice. So in starting this skill, we want to go ahead and perform our hand hygiene. We want to put on our gloves, and then we are going to start with prepping our short extension tubing. And in doing this, we would unclamp here, and then we are going to connect it to our saline, and we're going to prime the tubing because we do not want to start an IV that has air bubbles in it. Okay. Okay, and then we're going to clamp here. Okay, set that there. Get these out of the way. And then what we're going to do is we're going to go ahead and we're going to apply the tourniquet to the patient. And I did want to note that I did choose a 20 gauge needle. I have an older gentleman who is going to just be receiving some fluids. So we're going to go ahead and start their tourniquet. And when we're doing this, we want to make sure that it's snug but not too tight. And we want to place it 4 to 6 inches above the insertion site of the IV. And once we have it secured, we want to feel for a pulse distal. Okay, great, it's there. And then from here, what we're going to do is we're going to start with cleaning and cleansing that area. Oops. My other ones. And we're going to clean from the inside out for 30 seconds. We're using alcohol wipe. Okay. Alright. This is a little bit loose. Okay. Now, and just re-securing that, I didn't touch the site. But if I was to touch the site, we would definitely want to re-cleanse it. And when we are cleansing, we always want to make sure that the area is dry. So we're going to go ahead and get our needle ready. Okay, and when we are doing our insertion, we always want to do bevel up. So we're going to go ahead and we're going to start by making sure it's bevel up. We're going to anchor the vein 1 to 2 inches above the insertion site. Okay. Okay, so we're going to go in. Okay, and now we're looking for flashback to make sure that we are in the vein, and once we are, okay, we see flashback. Now we're going to go ahead and we're going to advance 1 to 1/4 inch into the vein, and in doing this, we want to make sure that we remove the needle as we advance the catheter. Okay, but in doing this, we want to anchor the vein. Okay. And then for this, we want to use our safety feature mechanism and put it into the sharps container. Now that we have the vein anchored, we're going to go ahead and remove the tourniquet. Okay, and now we're going to quickly unclamp and connect our extension tubing. Okay, right, and we're still securing. Okay, and now we're going to back flush, or retract a little, aspirate, and then we're going to administer our saline. Okay, and now we're going to clamp the tubing again and disconnect. All right. Okay. And once we've done that, now we want to go ahead and apply our sterile dressing. Okay. Right. And when we're applying this, we want to make sure that we place the dressing just below the tubing in case we need to change it out. Okay. Right. Okay. And now what we're going to do is we're going to remove the tape. Oops. We're going to remove that tape part, but we're going to keep the part that we are going to label with our initials, the insertion start time, the insertion or the catheter size, the date, and the gauge. So our initials, the start time, the date, and then the gauge. So we're going to go ahead and place that here. And we would, write that in. And then we're going to go ahead and secure this alongside the forearm on the patient. Okay. Right. And then we're also going to gently secure this port. Okay. All right. So that is the skill of inserting an IV. So we're going to go ahead and remove our gloves now. Okay. And then leave the patient's room, and then we're going to come back and we are going to perform our hand hygiene. Okay. And then we are going to discontinue the IV. Okay. I did want to know, oh my gosh, this is so tight. After we're done inserting the IV, we would obviously clean up our area and dispose of anything. So maybe I should back up and do that real fast. In a real setting, we would be cleaning up our area, right? So let's just get this. So we would dispose in our waste bins. Okay. And then we are going to leave the patient's room, and then we would come back, right, to discontinue the IV. So we'll go ahead and do that. So when we come in the patient's room again, we're going to perform our hand hygiene, and then we're going to place our gloves on, and we're going to gently remove the tape. Okay. While securing the catheter, we want to make sure that it's not tugging too much on the patient's skin. And then we're going to secure it. Okay. As we remove this. And then what we're going to do is we are going to gently place the gauze over the insertion site and gently remove the catheter, and we're going to hold firmly for 30 seconds, and then we always want to make sure that we inspect the catheter and make sure that it's fully intact, and also the size, 20 gauge, and then we're going to dispose of it in the sharps container, and then we would place a piece of tape over the patient's forearm there. And then we would remove our gloves, clean up our area, and then we would perform our hand hygiene, and then we would exit the patient's room and then document the procedure.